So thank you for this important question. UTUC or upper urinary tract cancers in the urothelial are usually treated by radical nephroureterectomy. So radical surgery in order to treat papillary low-risk tumors. In some patients, organ-preserving approaches were performed by using, for example, a resectoscope or a laser application in the upper urinary tract. So it's good to have new options available in some countries or some regions to possibly treat lesions of the upper urinary tract. The OLYMPUS trial, it stands for Optimized Delivery of Mitomycin for Primary UTUC Study, which was first presented last year ago as late-breaking abstract at the AUA. They used gel form. It's instillation of, it's called UGN 100. It's an investigational formulation of mitomycin gel, which sticks to the calyces, which sticks to the urothelium of the upper urinary tract. As we know, it's very tiny spaces, and here a gel combined with mitomycin active substance made the difference in reducing, showing a 60% complete response rate in a subset of patients with initially endoscopically unresectable low-grade upper urinary tract cancer. So the aim was to show response rates. The key points are in the trial, in the OLYMPUS trial, 71 patients had undergone primary disease evaluation at the time of the analysis. Of them, 41, so 60%, achieved a complete response. Of the evaluated complete responses up to the presentation at the last year's AUAs, 27 patients had so far undergone a 6 months evaluation, which is important. We have most of the recurrences within the first half year. And out of the 27 patients, 24, so almost 90%, were disease-free at 6 months. So 3 out of the 41 patients who achieved a complete response at relapse have relapsed within the study. So we really have to do checkup. But it's some treatment option to cure or stabilize the disease when it's not muscle invasive, when it's a low-grade superficial UTUC. Since this was a pivotal trial, an open-label, single-arm phase 3 trial with a limited number of patients, we don't have a comparative arm. So as of the result, the authors also concluded that this minimal invasive chemoablation approach using this UGN 100 in this population was a safe situation, and the adverse events were reported were not severe as compared to other techniques of organ sparing, like the use of laser or resectoscope. So this is a safe option for patients with upper urinary tract low-grade carcinoma of the urothelium. So personally, I think the patients that benefit the most are the ones where you treated the low-grade upper tract urothelial carcinoma with the laser and then give postoperative gel mitomycin instillation. So those are the ones that probably, due to the combined treatment, have the best benefit. Then also recurrent low-grade tumors in the urothelium might benefit. We have to see what other compounds deliver, and I know there are trials in the progress to plan and running to use other substances aside mitomycin to combine with a gel to apply for a longer time in the upper urinary tract. So I think the smaller the tumors, the better the chance for cure, the less staging, the less grading we have. Low-grade tumors are probably the ones that affect the best. We will have to see when it comes to high-grade or carcinoma in situ lesions how this regimen might work, and we will have to await further data from further clinical trials with regards to efficacy and also safety when it comes to high-grade lesions of the upper urinary tract.